This is the Hope Not Nope podcast,
where we answer your questions and share inspirational stories to fill your soul with hope.
Our mission is to empower hope to those who have been plagued by nope.
I'm Dr. Dylan Caswell.
And I'm Brandy.
And we're here to bring you out of the nope and into hope.
Welcome to the Hope Not Nope podcast. Thank you so much for tuning in. We are so grateful that you are here, and we are grateful for Trey, who asked this question. I hurt my left shoulder while bench pressing. I've given it some time to rest, and it's still bothering me when I go to bench. At what point should I get a cortisone injection? I think that escalated very quickly. Because like my shoulder's kind of been sore from benching, but I've never thought of like, should I go get a cortisone injection? Granted, I don't really think that way anyways, but
Right.
I feel like we're missing a little bit in between, no offense,
Well,
right?
I would say that it's very common.
Really?
And
Okay.
And it's been very common for a long time that like, hey, shoulder hurts, I'm in pain. How do I get rid of pain? We get rid of inflammation. How do we get rid of inflammation? Well, a cortisone injection. And then it became, well, instead of cortisone injection, what if we send you to physical therapy? And if physical therapy isn't working, then we do the cortisone injection. And then when we look at high level sports in the 90s and in the 80s,
Yikes.
a lot of injections
Yeah.
going on. Not steroid injections, but in the sense of like performance enhancement steroids, but non-steroidal and anti-inflammatory drugs, cortisone, things like that being injected in the locker room. Numb it, get out there and go play. And that was the model. Numb, go play. Numb, go play. Do what you gotta do to get through the season, and in the off season, go take care of it. And to think that that doesn't happen anymore, we'd be kind of naive to think that. It's just been more regulated on when, where, and who can do that type of injection. So it's very common, and I'm sure maybe Trey's been in a locker room with that or has been told that, or especially the older generation, that's the like, doc, my shoulder hurts. Yeah, exercise. Okay, got it. Can I have the injection?
Yeah.
Like, I gotta go do that for 4 or 6 weeks. You can do this right now and I can feel better.
Is it
Cool,
really
let's
that
do it.
simple too? Like you could go to a doctor's office and be like, can I just get the injection? Like there's no
Depending which office you go to.
Oh gosh. Well, there's that.
Because there are, practice guidelines, and that this is the best practice. And in that, in the medical world, that practice guideline says if somebody does have shoulder pain and you don't have a reason to believe that they need imaging, like there's not a fracture or a significant tear that would need surgery right away, like refer them to the people that can help them. And those people tend to be physical therapists. And so physicians have come a long way in that, and others have not. And partly, like, we can't just blame one side or point fingers, but it's also that some physicians in areas, they've probably attempted that. The person went, got really crappy physical therapy, and people just started coming back at 4 weeks anyway and saying it's made no difference. My arm feels the same. And at some point they probably said, you know what, why don't I just save you the 4 weeks and just do this now? And so it's a two-way street.
Sure.
Right? We can't just put it in one side and not take ownership for what we know is happening out there.
Yeah.
So I do think it's pretty prevalent, and it happens. So it's a big jump in a question of like, I have pain while bench pressing. Should I go get a cortisone injection? But I very much understand why that, or where that comes from.
Sure.
To answer it, so I'm going to answer this in a way of if Trey was one of our athletes and asking this question.
Well, I'd like to think of that, like if you're coming to us with this question, you value the way in which we work with people and we work with our athletes. And so that's how you should answer the question,
Yes.
Dill.
Yes, and I've learned that to answer a question for an athlete, you start with the exact answer first, then go into the explanation, and then come back to the exact answer, and then go into the explanation, and then have them repeat the answer back to you to make sure that it's gotten through. Right?
Exactly.
So Trey, you're gonna repeat it back to us, but you're just gonna have to say it in your car or
Right, or
gym,
you're
wherever you're
listening.
listening to it. So to answer your question, At what point should I get a cortisone injection? I'm going to answer that with no.
No,
No,
at no point.
no point. And I'll say no, but I will also kind of caveat, like, so one-on-one talk with Trey, no, we'll go into why. Outside of that conversation, I would still say no, but I understand why people would
Mm,
go for it. And that reason is because of pain control.
yeah.
Like my shoulder is killing me. I can't move it. I can't function. I need something to bring the pain down. Tylenol, ibuprofen is not touching it. Please do an injection. Like I can understand why people would opt for that. In the understanding, I would still say it's not a good idea. And the only way I might be more flexible on it is if it's a adhesive capsulitis or a frozen shoulder. Might be a little bit more flexible in that, but I would still kind of sway them and be like,
Mm,
I don't know. Like I get you want to bring the pain down, and I understand that this is a way to do that, but what else happens with it? So back to the conversation with Trey,
okay.
because it doesn't seem like frozen shoulder
Mhm.
or anything like that. So no, there's not a point in which you should get it. Why? Because there's a lot of other things we can take care of first that we're going to touch on. But first, what I want you to know with the cortisone injection is, does it decrease pain? Yes, it does. It shows very well that it decreases pain short term. So within the first 2 weeks. Does it improve motion? It can, but it's because the pain has been decreased. So the body is allowing it to move a little bit more.
Mm,
So, yes, it can do those things. Is it better than placebo? And there's first couple weeks, maybe. But at 6 weeks, 8 weeks, 12 weeks, and beyond, no.
mm,
There's no significant difference in those time points. So now we have to look at, well, what's the benefit versus the harm of it then, right? Because like, okay, cool, I get pain relief for 2 weeks, and then I'll do the other things that are going to lead to a long-term result. So like cortisone placebo, like, no, give me the thing that will decrease it in the 2 weeks. Well, here's what happens. It's a major anti-inflammatory. When that happens, the collagen tissue that is being formed to help heal that tissue, it is becoming inhibited, meaning it's going to weaken that structure. When we rely on cortisone and we're not taking into what's happening at the tissue, what we do is we end up setting up the athlete for risk of rupture or
mm,
risk of higher injury in that, because the cortisone, although it's taking down the pain, it's inhibiting the inflammatory process, which is inhibiting the collagen formation, which probably is needed because it's more likely than not some type of tendon issue, whether it's a tendonitis or a tendinopathy. There's something going on with the tendon that next phase of inflammation is going to be helpful, and which is now being inhibited, which now sets you up to potentially have more risk of injury.
mm.
So there is a harm to it, and that's why we put it as in this, not the no harm, may not help, may not harm category, but we put it in the like to don't category.
Yeah, do not do
Don't
this.
do this because of that. And we don't have this data, but I'd be interested to look back at athletes that were playing through injury and end up having a full rupture in whatever tendon or body part, and how many cortisone injections did they have
Mm,
leading up to that point? Because I get it. Like, I want to play. I'm a warrior. Let me go in. Give me whatever I need to do to go play. Okay, we can do this injection, take off the pain, go play. Well, one, you're masking the symptom that's telling you how much you are capable of doing right now. And two, you're decreasing the resiliency of that tendon that's already injured.
mhm.
Like, no, this can be setting the athlete up for failure. So at what point should you go get the cortisone injection? In Hope Not Nope's world, we don't see a place for it
Right.
because there's other things that we can do that are going to get you the benefit without having those negative side effects
Hmm.
with it.
Well, we like saying here at Hope Not Nope that pain is a request for change. And it sounds like getting a cortisone injection is ignoring that request and just trying to numb the pain,
Yeah.
which is not, that's just never the solution because there's a request being made and something needs to change in order to help you heal and become better. And a cortisone injection is not the answer to that.
Yeah. Patty Mahomes.
Patty Mahomes, baby.
Been waiting for a while to bring him up because I didn't want our listeners to get too irritated with my Patty Mahomes
I'm
comment,
very proud of
but
you.
I've been very disciplined.
Don't worry, listeners. We talk about Patty Mahomes on a regular basis, even if we don't do it on the
Yeah.
podcast.
First of all, lay off his dad bod. Like, can we lay off of that? Like, oh, he's a dad bod, he's out of shape. Like, have you seen him perform?
Right.
Like, come on. So I seen his trainer defending him well, so I just thought I could maybe help
Yeah.
in that. But two, back when he had an ankle sprain and it was in the playoffs, I remember an interview and they were saying like, "How were you able to play on this? Did you get injections?" And he's like, "No, like I meditated. I'm working through it. I don't want to take away that feeling
Mhm.
because it lets me know what am I able to do on this thing. And if I'm numbing it out, well, I might put myself. He didn't say this part, but if I'm numbing it out, I might be putting myself at higher risk because I'm not getting feedback
Mhm.
for it. And again, if it's chronic pain, a little bit different, but there's going to be a strategy for that that's not cortisone that can help you to honor the request for change that's happening.
Mhm.
So yeah, so I don't think there is a point
Yeah.
in which you would get cortisone. If your pain is like super, super high at 10 out of 10 and that
I I
like,
mean, not to be whatever, but like with my foot injury, and I don't know if like with complex regional pain, if I would have technically been a candidate for cortisone, but I'm
mhm,
assuming I would have been if I would have gone to a pain management doctor, which I did, and they suggested putting me on medication or doing an injection. So I'm
mhm,
assuming that's what it was. I was just young. But anyways, all that to say, like I had that for 8 years
okay.
and I was able to get through and come out victorious. I think that Trey can be victorious in his left shoulder irritation because of bench pressing.
Yeah.
So,
And there's a lot of things that can be done. And if you're at that high, high, high level of pain, 10, 10, you still don't need the cortisone
yeah.
injection. Like this is a time where manual therapy plus exercise, not just manual therapy on its own, but manual therapy in conjunction with movement, with addressing psychosocial factors while giving some certainty into what's going on, like it can play a role in decreasing the sympathetic tone and decreasing that pain experience that you're having,
Mhm.
right? And we can start looking at some other things, which I'll touch on quickly for
Okay.
Trey, because this will be part of the conversation.
Yeah, I was
So
gonna ask what can you do
yeah,
then?
yeah. So Trey, yeah, I don't see a point in you getting the cortisone
Yeah.
injection because it can, yeah, it can take off the pain for a couple weeks, but long term, the outcomes are the same with placebo or that injection. And it can be more harmful and create a little bit more tendon damage than recovery, which you don't want.
Mhm.
So no, there's not a time frame for that. There's other things that we can address, right? So now Trey has heard twice in the conversation not to get the
No,
injection.
no, no.
So what else can you do? Well, let's take care of the low-hanging fruit. You said this is specifically with bench pressing, right? So let's dive into that. Have you tried decreasing the weight?
Yeah.
Right? Like simple things that go so far. Have you decreased the weight? Yes, no. Have you decreased your overall volume of
Mhm.
it? Have you modified the range of motion? Is it happening at a particular part in it? If it is, well, let's use some blocks and do some block bench pressing. Let's move to the floor and do some floor bench pressing. Is there variation in your program, or have you been benching the same intensity at the same rep scheme for a year?
Mhm.
Like, have you had fluctuations where you're hitting more hypertrophy, ones where you're hitting more power, ones where you're hitting more pure strength? Like, have you had that variety in your program that's allowing your tissues to adapt differently, right? Looking at muscles, looking at tendons, and seeing what stressors help these adapt in different ways. So, having that, do you have variety in it in the sense of variations of bench pressing? Are you always using the barbell or have you mixed in the dumbbell?
Mhm.
And what does that do? Well, in a bench, if you have a dominant side, that side can push more than the other side. So what side ends up getting irritated? Well, the side that has to push more. And there's good data showing that rotator cuff related shoulder pain, which is a big fancy term that took place of shoulder impingement, so rotator cuff related shoulder pain, that a person is 2.8 times more likely to have it on their dominant side than their non-dominant side. Well, why does this happen in athletes? Well, you're using it more when you're benching. Yes, you're moving the bar, But do you know if one side is doing 60% and the other is doing 40, 70, 30? How close to 50-50 can you get in that pressing? Is it going to be a perfect 50-50? No, but we can strive to get near that. Dumbbells bring that out,
Hmm.
right? You go down on a dumbbell press and you work up to a 5 rep max, which is what we'll generally use to test. And all of a sudden, I'm right arm dominant. Oh, my right arm finished a rep. Well, my left one's still at half range. Oh no, my left one's not moving anymore. What's
Yeah.
happening? Oh, yeah, there's a difference between these two things.
Hmm.
So that is helpful in order to look at that and say, oh, well, this is sore because, yeah, this one's doing more in
Hmm.
that motion.
Sure. Um, I also think too, with Trey, he said that he's taken some time off and then he hopped back in. Did you ease back into your
Oh,
program,
yes.
or did you just go back to what you were doing?
Yeah.
Like, say you rested for 3 or 4 weeks. Awesome, great job resting. But did you ease back in, or were you just like, all right, what was the rep scheme I did right before? Let me just hop back into that because if you did rest, you do need to ease back in. And
Yeah.
you probably haven't necessarily lost strength in
Yeah.
those couple of weeks, but your body still needs to get used to the pattern, and it's just basic progressive overload and great
100%.
exposure.
Yeah, if your shoulder got injured when you're benching 225, you know, maybe start at 95.
Yeah.
How did that feel? Okay, let's progress it up to now 115. How did that feel? And work yourself
Mhm.
back into it. And again, don't be afraid of losing the strength. You're going to have some residual strength pending your training age and how long that you've been doing it. So great point. So
Yeah.
happy you brought that up. One of the main principles that we have to address, progressive overload, getting back into it, graded exposure. And then the last part I put in there is just we talked about the variation in benching, volume, intensity, modifying the range, barbell versus dumbbell, and the different variations within that, flat bench, decline, incline, like all those different things
Mhm.
that you can do to sprinkle in some variation throughout your training year. But then also, how trained is your anterior upper quarter versus your posterior upper quarter? Because a lot of people will say, oh, I'm benching and I'm doing pull-ups, so I'm getting my back and then pushing. Well, again, the lat from an anatomical perspective, it's going to start at your sacrum and it's going to wrap around, come up the back, and it's going to wrap around to the front part of your shoulder because it's a shoulder extensor. So it brings your arm back.
Mhm.
So it has to attach there in order to move it back that way. It attaches similar area to where the pec attaches over into there. So if they become more dominant, now the whole shoulder complex is being forced more anteriorly or forward.
Mhm.
So is there balance in your program with your horizontal pulling to help match the forces that you have on the upper part of your upper quarter?
Mhm.
So
Awesome.
look at all those things, easy, low hanging fruits. All of those should be addressed before cortisone is brought into the conversation.
Yes, yeah. And I will say we have had previous episodes on bench pressing, and we even did a YouTube series, and we had bench pressing within the YouTube series as well. And so I'm going to link those below because I think those two videos will help you with this question also.
Oh, awesome. So Trey, thank you for the question. Hope story time.
Yeah. You got one? I
I'm gonna
got one.
pass it to you.
Well, actually, I think we should just do a triple hope story thing because I just realized it all at once.
Triple hope story,
So to
soundboard.
So, hope story for me, hope story for you that I'm going to say about you, and then
Okay.
hope story for the third one, but I'm going to start with the third one. The third one is, and may have mentioned this over the past few weeks, but every summer, at least for the past 2 years, we've been doing a competition with our nephews, and they're teenagers. It's a lot of fun. They're both like three-sport athletes, and we compete against them. We do some lifting, we do some running, some field events. It's really a fun day. Well, not too long ago, we had this competition, and our nephew, I think PR'd his bench, but it was a struggle. Like
Mhm.
he was, benching 135, and it was a struggle, but he got it. And I
Yeah.
remember thinking like, oh, that was awesome. He did so great. Not even a month later, he reaches out and said, I just repped three at
Let's
135.
go.
And so just to see, I mean, teenage boys in the weight room, like they improve very quickly. It's really cool because they have so many hormones like pumping around in their bodies and stuff like that. But just to know that not even a month later, he hit that. But then what brought up what I realized in my brain was that we both PR'd our bench presses
Yeah.
recently as well. And so that's why it's a triple hope story.
Triple hope.
And the theme of bench pressing is the conversation of the day. So I was like, oh, we should just have that be the hope story. I PR'd, you PR'd, he PR'd, and then he 3-rep maxed his PR. Like, what a great day.
Yeah. Yeah. And I'll say lifetime PRs
Yeah.
for us because a lot of, oh, like what PRs in your 30s, like 20s, like no, like lifetime PRs. And it's so cool because we do have an athlete like mid 50s ready to PR
Yeah.
bench and like a lifetime PR. We can continue to get better.
Yeah. Doesn't matter if you're in your teens, your 20s, your 30s, or like our other athlete who's in his mid 50s. You can keep getting better.
Keep getting better.
It's really cool.
Keep doing those arm squats.
Yeah, exactly.
Well, thank you for listening. Have a great week. And remember, every day is not just a day to be hopeful, but an opportunity to become hope.
The Hope Not Know podcast is meant for educational, informational, and personal development purposes only and does not constitute any health or medical advice. If you're looking for specific advice, connect with us to work with a Hope coach. The Hope Not Know podcast shall not be liable or responsible for any loss or damage allegedly arising from any information or suggestions in this podcast.